APAC. See, this is one of the excellent event where as of my understanding, I think this is the only one talking about the health and technology together. Normally, most of the conferences we used to attend is they will talk about the patient services, healthcare industry, enhancement, all the things. But today, without technology, no healthcare. So this is the right area which you are focusing. I think I appreciate if you can come with these kind of programs where we will also effectively can participate.
Sure.
Thank you.
Thanks. Since you are talking about this intersection between health and technology, can you take us through what are the solutions and services that TriMed offers, and what are your future business roadmap?
See, being a healthcare technology management company, actually today we talk about healthcare technology management is all about equipment. Then second one is IT enabled. So IT has really boomed in India. So that has helped us to grow to the next level. Like AI, ML, all these things, how to do the data analysis to improve the patient's services and other things. Whereas the other part of it is technology is actually in before 2000, if you talk about healthcare technology, they talk about only equipments. There is a biomedical equipment where we have new equipments coming out in the market, new technology, then upgrade during the better diagnosis. So all these things started in 80s 90s, whereas after 2005 to 2010, this is where the IT is booming in India. That is a time where biomedical slowly it take the backseat, because what is happening, even the equipment, if you say half of the equipment ITS already get in, because data processing, signal processing, everything, again we require software. So all the things started in medical equipment as well. So that is transformed to this side on the patient safety analysis, digitizing the medical records, and all the things started on one side. But biomedical engineering left as it is. What it was in 2000, early 2000s, I can say, even today it was almost same. There is no much improvement. But later the government of India has comes in 2014 and 15. They are doing some survey in India. They find that in the government sector almost 40% of the equipment was not working, which is just a year old, 2 years old, 3 years old. So government has spent so much of money on buying new equipment, but it is not used for patient services. So then they come to do some private public partnership programs, where I myself was experienced about 33 years across the globe in various countries. Then with that experience I come, and we propose these kind of programs to the Ministry of Health. Then they take it up in the right spread. So it started in the government sector. Whereas to the private sector, biomedical engineering is expenses for them. So anything coming as expensive, they try to minimize it. So the budget for biomedical equipment is not that great in the country. Whereas it normally about 5 to 6% of the equipment cost has been spent for its maintenance. But whereas that is not the case in India. So what happened? They will try to give only 2 to 3% of it. So they try to manage. So everywhere they're taken as a shortcuts. That's what there is a one study which has been proven that only 3 to 4% of the equipment are carried out calibrations as per NABL.
So specifically from the TriMed perspective, what have you been doing?
So what we do with this, by identifying the gaps, what is in the system, so we come sort of the totally a transparent system, that is maintenance management system, where that will schedule the maintenance 1 year in advance, calibration will be scheduled, then periodic training will be provided to the users for how to use the equipment, how to take care of the safety, then as well as the maintenance, that is repair maintenance of work. So this is the four aspects.
Work with all sort of equipment from any vendor?
Yes, we work with any even the lowest we can say that now BP sets, electronic BP sets, to the CT scan and MRI scans, that level. So we provide we provide calibrations, and this is basically a multi-vendor concept. And we will not specific support one vendor or different vendor. So these are any manufacturers. So we will be providing services.
And you work with both public and private hospitals?
Yes, we do. So we do calibrations. Of course, now all the corporate hospitals, actually we are the only service provider for them. And in some of the private hospitals, we are doing the complete maintenance management also.
How many hospitals are they working with now?
In the government, we are doing right now 8 projects we are doing in the government. 8 states actually. 8 states we are working. In the private, we are doing about 25 hospitals we are providing services.
That's also again across India.
Across India. And the calibrations, of course, from north to south, I think we are providing calibration services to our force wherever it is required.
So any impact of the recently medical devices? There were some policy-wise revisions done. So any impact of that?
Yeah, definitely. Even we are part of that medical device policy as well. So we'll be giving a lot of our inputs how to, because taking the the inputs from the various countries, how it has been done in other countries, Europe countries like US. So how to implement to the Indian scenario. So accordingly, they have been modified. That's the reason now they comes out with the in the parliamentary panel. Last time we met, there was a discussion was going on. They want to form a separate ministry for this. This already in the proposal now. So government of India has promised to consider this. We are expecting maybe in a year or two that will be
Like
coming in.
Pharma was
Exactly. Right now, the medical devices are attached with the pharma, because most of the pharma companies and experts are making decision for medical devices, whereas that should not be the case. So now, like this, this will improve, I hope, and this is a very beginning. In the medical device in India is a beginning actually. Still, a lot more to go.
And another thing is, anyway, most of the medical devices are important. So any starting point about locally made?
Yes,
devices?
even now, many people don't know that, a CT scan, MRI scan is manufactured in Visakhapatnam, AMTZ.
Yes.
And the MD, Dr. Jitendra Sharma. So he was taking this as his personal interest. So he's trying to establish. He called various companies.
MTZ also had these robotic surgery things.
Yes.
I think in Rajiv Gandhi Cancer.
Exactly.
Hospital
You are
only
right.
in
You are right.
Hyderabad.
So not only that, actually they are
The
constructing.
launch I had attended.
They are one hospital. They are constructing within AMTZ, where all equipments is made in India. There is no equipment will be imported for that particular thing. So we are into this. There is a lot of manufacturing activity started in India. Of course, it's not overnight we can able to do everything. It is a matter of time. Definitely, I think another maybe in a decade, I think we will make at least 60% of our own requirements within India itself.
So that will ensure the affordability, because right now the pricing is and that increases the healthcare
Yes.
cost. Also.
See, if you can see any hospital, almost for 50% of the budget goes to the equipments. So this is where we are. See, that money we are losing to the other country, foreign exchange. So vice versa. So a lot of problems. Even spare parts, you can see that. Where CT scan tube we used to buy in Indian rupees those days. The same tube I'm talking about, same tube, which is costing about somewhere about 15 lakhs. Today we are paying about 35 lakhs for the same thing, because that time US dollar was 32 rupees. Today we are 82 rupees. So accordingly we have to pay.
And the
So
same thing will be
passed on to the hospitals. But hospital claim that I used to pay only 3% as the maintenance fee. Today it's coming 4%. So where I will spend that money? So this is like a effect which is going on. Hopefully right now things are improving in the government sector as well as the private sector. In the private sector is concerned, actually there are a lot of hospitals now. They started realizing the importance of these biomedical maintenance and other things. But unfortunately, there is a severe shortage of biomedical engineers in the country. See, that is where it is becoming a challenge to us, because training them, because biomedical engineering, something like that,
it's not there so much in the academic curriculum.
No academic. So we have to take them and train them. So that is what, as I was mentioning in my.
So how would it fit in? Will it be in the MBBS curriculum or more in the engineering curriculum?
No, it is. They will study the anatomy in the beginning of the stage, and later they will study the biosignals. Then converting the biosignals into the digitization equipment. That is how it is.
Will it be the medical colleges or the engineering colleges?
It's engineering colleges. It is engineering colleges. Now in South India, like Kerala and Tamil Nadu, yes, there are a lot many colleges teaching biomedical engineering. Whereas coming towards the North India, yes, it's a very few colleges are teaching it. That is the reason we are having a severe shortage of biomedical engineers. So that's what, about 2 weeks before, there was a meeting taking place in Vizag. There's an Indian biomedical skill consortium actually. So they are some of the private parties and the AMTZ joined together. So we developed the biomedical engineers and provided the necessary training and certifications. Even Quality Council of India agreed that if we can able to produce enough engineers through the certification program, even they can able to make, this is one of the mandatory requirement for all the hospitals to have at least one certified biomedical engineer in the facility. So that is also we are working towards it.
The last question I would like to understand is some of the private hospitals are doing things like robotic surgeries, and but that's still very exorbitant because the equipments are not. That AMTZ Rajiv Gandhi was an exception, but the likes of Apollos and Maxes are doing. Um, Apollo does some cardiac surgeries. Max has been doing, I think, those orthopedic surgeries.
Ophthalmic also they're doing it. Ophthalmic also they're doing it.
So, what is the future there in terms of these robotic devices?
Yeah, definitely the defined procedure, like if you can see that so even angioplasty there is a possibility now. Robotics can get in entire ophthalmology side. Yes, there is some of the plastics
will be very convenient.
Yes,
when you insert that camera through.
So it's a much easier in future. Maybe in next, the way how things are moving towards, because we have a severe shortage of radiologists in the country. So that is the reason our AI in radiology has taken up very well. Whereas we have, if we get into more shortage of the specialist doctors, I think naturally the robotics will take over in some areas. That is going to be happen in the country. That is for sure.
Okay. Thank you.
Thank you.